yung hindi pa low-risk areas, yung mga areas na mahina ang connectivity, pwedeng sa October na, pwedeng sa November na. Yung po yung spirit of the law. Nabigyan po kayo ng karapatan na i-adjust yung opening as long as you will comply with the 220 days requirement. So ang tanong ko ulit, nag-conduct na ba kayo ng hearing? Ng consultation?
The way it was asked, Mr. Chair, yung consultation halimbawa po sa mga stakeholders na nandito po ngayon, wala pa po yun, pero mahalagang
so you have,
maitagdag po.
Ang deadline po, Yusek Kumali, ang deadline po na tinatadhana ng batas ay August 19. Dapat labas na yung ating implementing rules. Next week na po yun.
Wag po tayong mag-alala, Mr. Chair.
Linggo ng wika.
Senator
Hindi pa nakakita ng kopya yung committee ng inyong draft implementing rules and regulations.
Opo, Senator Tol, Mr. Chair, wag po mag-alala ang ating pong butihing Senador Tol Tolentino po. Yung bahagi ng konsultasyon, kung hindi po mangyayari po ngayong linggong ito, ay sa susunod na linggo po namin gagawin. Senator, Mr. Chair, meron na po kaming draft na nagawa. Meron po kaming proseso po kasing sinusunod pag gumagawa po ng IRR. So kaagad-agad pong inutos ng aming kalihim na balangkasin po itong IRR na ito. So very quickly, we start with a working draft and then led by our legal department ay nagkaroon po ng several within department meetings. Siguro nakaka-4 o 3 meeting na po ito. Hindi po yan bababa sa 3 pagpupulong. At yung produkto po dito ay mayroon po siyempre muna kaming working draft na ipepresenta po dun sa aming kukonsultahin. The way we...
Yun na nga, Yusek Kumali, ang hinihiling ko. Sana, hingan din natin ng inputs itong mga stakeholders na nakikinig ngayon sa inyo. Itong mga bumubuo ng sa pribadong sektor, yung mga teachers association, yung mga magulang, na sa ganun, meron din silang maibahagi sa na inputs dito sa lalabas na implementing rules at kasama po yung mga local officials kasi po sila na naman ang bubuno nito. Paano kayo mag-o-open ng eskwelahan sabay-sabay ng August 24 kung yung ibang mga lugar sarado, naka-lockdown, walang kinikita yung mga magulang, walang trabaho, walang livelihood, paano makakatulong sa kanilang mga anak yon? So, we have to consider all 3 factors. 1, health. Number 2, livelihood. Number 3, yung interconnectivity. When you craft the implementing rules for Republic Act 11480. And if you're planning to do that next week, ayun na po yung deadline, linggo ng wika. Ironically, August 9.
Nandito, makakaasa po kayo, Mr. Chair, Senator Tolentino, na lahat po ng mga stakeholders ay makukonsulta. meron lang po kaming, natapos na po namin yung bahagi, katatawag ko pa lamang po, pati po yung mga regional offices po namin, at meron na po kaming very good working draft to present to the stakeholders. Makakaasa po kayo, Mr. Chair, Senator Tolentino, the way we crafted the IRR of the K-12 law, we consulted everybody, the school feeding law, the Universal Kindergarten Act, the other education-related laws, the way DepEd is always doing this, Mr. Chair, Senator Tol, we will consult them.
Sana po, Yusek Kumali, within this week, mabigyan nyo kami ng kopya ng draft. Gusto talaga namin makatulong sa inyo. Yung mga
Opo.
governors gusto makatulong. Wala kaming kopya. Ulitin ko, mandato ito ng batas sa inyo. At pwede kayo magkakaso rito pag hindi ginawa itong implementing rules. Nakalagay dito, shall within 30 days. And that 30 days will expire August 19. And today is now August 12. So you have 7 days to go.
Yes, Mr. Chair, at gusto ko lang pong idagdag, yung 15-day publication requirement, hindi po kasama yun dun sa 30 days. Kaya we are still within the time period at we assure this honorable committee.
You're probably misinformed, Yusek Kumali. Ang nakalagay po
secured as of this point. Na kung meron pong mangyari sa kanila, kung kakailangan nila yung testing nila, at kung lumabas na sila at nahawaan sila, meron na silang pupuntahan at kukunan. We need to assure them Hindi lang yung just open-ended na may contribution. Assurance is very important in this case because without assurance, you don't have confidence. And without confidence, all of this will fail.
Mr. Chair, and I would, with respect to the financial aspect, we will request Undersecretary Sevilla to provide the answer. But with respect to how we see the teacher and non-teaching staff welfare from the health perspective, kasama po naman yan doon sa aming number 8. Malawak po yung health standards na yan, hindi lang po yan protocols, kung hindi yung support that we give. So dalawa pong components itong health standards na ito, and in fact, it covers also the students if should we allow face-to-face at some point in the future. But that health standards is paired with the alternative work arrangements that we have. At doon nabanggit ko na mayroon namang kasama doon na testing protocol. Ang tingin ko na hindi malinaw talaga, at nakita ko rin yung tugon ni Undersecretary Sevilla, is the hospitalization component. And right now, nabanggit nyo yung aming monitoring. We have been able to work with our internal support mechanisms, whether on within budget or off budget mechanism as a DepEd family. Pero yung baka mas makakasagot Mr. Chair ay si Undersecretary Sevilla with respect to the hospitalization. So talagang PhilHealth ngayon ang component dyan, pero wala kaming my understanding is a subsidy for the hospitalization itself. Pero yung pong testing ay malinaw doon na kung related to yung deployment of a teaching or non-teaching staff for na pumapasok sa mga na-deploy na may physical, whether in an intermittent basis, ay nakalagay po doon that we will facilitate the testing of the teacher. And when we say facilitate, it is either we can spend for it or through partnerships be able to secure the testing of the personnel. We committed to the media persons, Mr. Chair, and we will submit also to this committee an update on our monitoring of our COVID cases. As I mentioned, ang nakalagay lang kasi po doon, and which we have to clarify with the task force, ay cumulative po ito. We have figures for active cases at saka yung mga probable cases, but we just want to be very sure before we put this information out, Mr. Chair. But we will submit also to this committee the latest update on the COVID situation within the DepEd family.
Yusek, but ilan na po ang within your DepEd system, ilan na po ba ang na-infect with COVID?
Ang cumulative figure po na meron, which is subject to further validation in the sense of from a management perspective and the task force, ay ang cumulative po ay 598 from the field reports and 11 from CO reports, and this is a combination of personnel, teaching and non-teaching, and learners as well.
Itong 598, Yusek, sino po ang nagbayad nung kanilang testing and then yung aftercare?
Hindi ko po kayo masasagot. I do not have that information right now. Dito po sa 11 malamang kasama dito si Secretary Briones, for example, who tested positive, and she was swabbed by the Department of Health, for example, at that time. So hindi dun po sa mga na-expose kay secretary ay may ibang nagka-symptoms na test, pero hindi ko po kayo masagot kung saan nang galing yung actual funding. I know that there has also been some that nitong huli itong MECQ at nag-positive na we committed reimbursement. But in the field, hindi ko po masagot kayo dun sa lahat ng cases na ito, Mr. Chair.
Yeah. Yes, Yusek, I just want to put emphasis, no? Gusto ko idiin rin na we really need to take care of our people, no? In your case, your constituents, aside from the parents and children, are the teachers. And they're the most important component to the success of this LCP. At alam ko yung mga teachers natin, kagaya natin, natatakot rin sila lumabas eh. Alam nila pag lumalabas sila, delikado yung kanilang buhay. Alam nila pag nagkaka-interact sila, delikado yung kanilang buhay. So without any security as to testing, as to aftercare, mahirap po talagang parang hindi buo yung kanilang loob para lumabas at gawin yung kanilang dapat gawin. At I think what the department needs to assure is their plight, no, their welfare, and not only assurance but secure talaga na kung may mangyari sa kanila, meron silang pupuntahan. I would like to
Mr.
recognize
Chair?
Yusek Sevilla. Yeah, Yusek
Yes.
Sevilla. Yes.
Thank you very much, Mr. Chair. Kasi I would also like to contextualize my response to the media because the question raised during the press con is very specific. The question was, is there a budget cover or will there be financial assistance given to our personnel who will be found positive? And the question was also specific to treatment and hospitalization, not testing. So let me explain, Mr. Chair, our stand on this. And we need the lawmakers to support us on this. The budget law does not include any budget item for treatment and hospitalization, I think in all government agencies, not just DepEd. It is only DOH who has the authority to use their budget for medical treatment and hospitalization. So even if we want to even pay for their treatment and hospitalization, the result will be a COA finding to our department because there is no budget item that will authorize us to do that. What we have right now in our budget, and we have realigned actually some of our regular programs, is the supplies and support mechanism to implement our minimum health standards. It is in number 8, and Yusek Nepo is right in saying that this is not only for teaching position, but this covers all teaching, non-teaching, teaching-related, and all administrative staff as well. So meron po kami Department Order number 14, and this is an issuance, a guidelines for the health standards to be implemented, not just in the offices, but also in the schools. And imagine how many schools we have right now, Mr. Chair. And we have allowed the use of MOE to buy for the prevention, disinfection, decontamination. And the testing actually is also included, Mr. Chair. But if we will have all the testing expenses of all the personnel and the learners, ay talaga pong magkukulang ang budget ng DepEd dito. Kaya ang nangyari, we are following the protocol of the Department of Health in terms of testing, like for example, the eligibility or the qualification before you will undergo rapid testing and the swab testing. The rapid testing as well, we coordinated with the Commission and Audit, and they said that we really have to seek a legal basis for us to use our funds on this. So it will be very helpful, Mr. Chair, if the legislators will also give us the authority And of course, if there's a legal basis, we also need the funding cover. And we have talked to DBM about this, and I think the limitation is one, legal basis. Second is the availability of fund. But rest assured that all government employees, including DepEd, is covered under the PhilHealth insurance, and anything that will happen to them will be covered by this PhilHealth coverage. And our employee welfare and the finance strand will be giving the information and the protocol and procedures. In fact, dun po sa mga cases na sinabi ni Yusek Nepo, ay namomonitor po namin at nabibigyan ng assistance ang ating mga empleyado, including the learners, as Yusek Nepo said. Yung pong monitoring natin, I think, is really off budget, out of the personal care and effort of the department. And I think malaki rin po ang tulong ng local government units. And Senator Win, you really know this. Kahit po kami ay mga taga-DepEd, sasagutin ng local government pag alam nyo na meron pong kaso na estudyante, lalo na po kung teacher. So this is in cooperation with DOH, the local government unit, and the PhilHealth. But if there's a need to also provide under the DepEd budget, for example, financial assistance and medication or treatment, then it has to be authorized by our law.
Yeah, but Yusek, you're absolutely correct, no? All of us being government employees, meron tayong PhilHealth eh. Automatic na yan eh. Meron rin tayong GSIS, automatic na yan. But have you networked with PhilHealth to give special attention to our teachers, to our non-teaching personnel, considering that they will be executing a relatively risky learning continuity plan? My point of the matter here is they will be going out now eh. Or pupuntahan sila ng magulang. No? Either way, may interaction. Ang punto ko lang naman is, have we exerted extra effort to secure their health needs and their aftercare needs? Granted, wala tayong budget sa 2020, but there are other ways, no? Like PhilHealth nga. So have you networked with PhilHealth and make sure that our teachers get some form of security?
Yes, Mr. Chair, our Bureau of Health, Bureau of Human Resource, and Employee Welfare are now, there's an ongoing negotiation with PhilHealth on this. And ang ginagawa rin po namin talaga, Mr. Chair, is yung localized. Kasi it cannot be reported to the central office or the regional office. It has to happen really where the case is. At yung pong PhilHealth is really working on this as well. So we will have the communication and the information as soon as nagawa na po natin o na-finalize na natin yung partnership with PhilHealth on this.
Yusekan, it's just gusto ko lang for example, if I'm a teacher and in my duty of executing the learning continuity plan, nahawaan ako. Hindi natin maalis yan eh. No, may mga storya nga, pumunta lang sa mall, nahawaan na. So assuming nahawaan siya, ano yung gagawin niya? Saan siya pwedeng kumuha ng tulong para magpa-test? Of course, bumili ng gamot, and then of course, may aftercare pa yan kung lumala yung sagot niya. So, yung sakit niya. So, ano yung gagawin ng isang guro para ma-access itong lahat?
Mr. Chair, it is in the Department Order number 14, all the procedures and protocols. So we have a COVID task force down to school level. So the teacher will have to report to our task force in the school. At meron pong coordinator dyan, ibabato po kaagad yan sa division office. The division office will coordinate with DOH and the local government unit. At yun nga pong nangyayari, yung pong testing na binibigay sa ating mga naging cases ay courtesy of the DOH or LGU. Kaya yung tanong niyo po kanina, sinong gumagastos, most of them were accommodated by our LGU. But of course, some of the employees opted to do their own, lalo na po yung kaya naman, at nagmamadali rin. Halimbawa, there are cases na emergency talaga. The question is, when they go to finance and they want to reimburse. And when we ask COA if we are allowed to reimburse, we were given a question that we need a legal basis to do that.
Mm-mm. I think right now the fastest way is to tap PhilHealth and to tap GSIS for other needs. No, ito talaga yung mga insurance and safety nets na built-in sa atin bilang isang government employee. And ang ano ko lang naman is, I know PhilHealth now, nababasa niyo, I'm sure they have their hands full in answering anomalies. Kailangan talaga extra effort to make sure that mabigyan sila kaagad ng reimbursement, mabigyan kaagad sila ng tulong. Dahil alam ko yung PhilHealth rin matagal kung hindi kayo magkakaroon ng extra effort to link up with them. Ito lang ako, nababahala lang ako kasi lalabas na yung mga teacher natin eh. And kausap ko yung mga ibang teacher natin dito sa Valenzuela, natatakot talaga sila. And the only way na pwede nating himasin yung kanilang takot, i-assure natin, i-secure natin yung kanilang protection. Yun ang aking punto. And that's why I'm very compelled nga, to be honest about it, I'm very compelled to recommend to postpone class opening if we don't address the welfare of our teachers and non-teaching staff, because they're as important as all of these things that we are talking about, no? If you don't secure their health condition, if you don't secure their aftercare condition, might as well postpone class opening dahil malalagay talaga sila sa delikado. So just to move forward, Yusek and
Mr. Chair.
Yes, Yusek.
Just a manifestation, a quick manifestation that habang naandito pa po itong readiness components, that yung number 8, because even if I say it is subsumed there, I think it must be expressly stated as you observed, that number 8 should not be as in other words, might have a limited sense of health standards, but really make it express here that it also includes teacher and non-teaching staff welfare, so that it is clear that it is covered, and that also allows us to really specifically address that in our briefings, Mr. Chair. Thank you.
Yes.
Just a manifestation.
Before I continue, let me recognize the presence of Senator Cayetano, who is here with us. Good morning, ma'am. Just to move on to this topic, Yusek Ann, request ko lang to submit to us a position paper on securing the health concern, securing the aftercare, securing the welfare of our teachers and non-teaching staff. Just submit to us a position paper. Kung meron na kayong networking with PhilHealth and TSIS, just elaborate on that. Ang gusto lang naman natin mapakita, I'm sure from DepEd and from us, is we have secured the welfare of their teachers insofar as health, insofar as learning continuity plan. So, mas kampante sila ngayon lumabas at gawin itong pinapagawa natin sa kanila. No? Just to move forward on this topic.
Right. We will submit.
Yes. Senator Cayetano?
Yes, on that topic, just a very quick response, it's directed to Yusek Ann, and also for more clarification on the questions you posed. You asked about what kind of support is available out there. You mentioned also tapping into PhilHealth. May I just inform you, Yusek Ann, that when you mentioned that as far as you know, it's only DOH that has authority to use their funds, for testing or to take care for medical care of their staff. You mentioned rapid tests specifically. So I just want to spread it into the record, Mr. Chair, that rapid tests are not being endorsed. I think all of us are aware that the Alliance of Various Associations of Health Workers signed that letter requesting that mag-ECQ, right? And of 7 recommendations, around 2 of them referred to their very strong concern on the use of rapid tests. So since napakalaki ng population ng ating teachers, I just wanted to be sure that the DepEd decision makers are aware of that. In as much as it's very accessible, the price is very reasonable, the health experts are not recommending it, and as far as I know, national government is not allowed to use public funds to purchase it. So in your request that your call to the legislators to support, of course we support. I know the chair will make that call as well. but just to clarify that issue po yung rapid test, no? Let's be clear about it kasi baka doon tayo mapuntain because you specifically mentioned it. I'm just clarifying that as far as I know, rapid test cannot be cannot be purchased with public funds. Thank you.
Thank you for that clarification,
Mr.
Senator Pia. Yes, go ahead, Yusek Ann.
Yes. Thank you very much, Honorable Senator Pia Cayetano, for that. Kasi that I think is the explanation why there's a high demand for DepEd to do it. And we really are constrained because of that finding. We are aware, Senator, kaya nga po yung mga demand ng mga teachers on that, we have been explaining the limitation of the department. However, what I was requesting earlier, Senator, is that medical treatment and hospitalization as well is not authorized in our budget. So, rin po yun sa mga concern na I think should also be addressed.
I have no issue naman on that, but I just know that syempre lahat kaming legislators were very sensitive dun sa needs nyo, di ba? So baka mag-craft kami ng policy tas masama yung rapid test kasi yun yung question. But I'm glad you clarified that because I've also asked this Alliance of Health Workers, so itong mga specialists natin, to make that statement para maintindihan din ng tao kung bakit hindi nyo pwedeng gawin. And that's exactly what you said. Now, the demand is there. And baka akala lang nila ayaw nyo. And not only do you not have the authority to use funds in general, but even if you are granted the authority, I doubt if it will include rapid tests kasi nga it's not authorized. Yun lang. Thank you. I'm glad you asked that clarification. Thank you, Mr. Chair.
Thank you, Senator Pia. In fact, Senator Pia, you know this better than I do. In Bayanihan 2, we already specified spending for PCR test. Dati nung sa Bayanihan 1 kasi is generic testing lang eh.
Kasi, and I mean, as we all know naman, we're all learning from this, di ba? As early as Bayanihan 1, let me just spread into the record, the same Health Alliance group were already strongly advising that we should not be dependent on rapid tests. But at that time, we will recall, Mr. Chair, di ba? Rapid test yung available eh, di ba? So syempre, we seem to be constrained to respond in some way and to make testing available. But their position has never changed, no? Yun pa rin up to now. And now that our PCR tests are much more efficient, much more easily available, the more na they are pushing na dyan na lang tayo mag-focus. And I believe there are other tests coming out na better pa rin ang rapid. So whatever recommendations we make, Mr. Chair, let's just put the wording should be general enough na as authorized by DOH or as prescribed by our health professionals, something like that, no? Para lang walang maitim. Thank you.
Thank you, Senator Pia, for clarifying that. Senator Pia, any questions on the update of DepEd? We're moving to the second part, which is to discuss the laws of the other senators. But before we move on to the second part.
I was just listening naman, so I don't naman have any specific questions. Your questions, Senator Nancy's questions, Senator Todd's questions are similar to mine. So okay na po ako. Thank you so much.
Thank you, Senator Pia. With that, we move on to the second portion of our agenda, and this is to discuss the several laws that I mentioned earlier, specifically the law that Senator Angara filed, Senator Tolentino, Senator Lapid, Senator Revilla, and yours truly. And this pertains to disaster preparedness and also inclusion of disaster preparedness and mitigation in the curriculum. So I would just like to ask DepEd for their comment on all of these laws. All of these laws are one way or the other similar to each other. So I would just like to ask for an omnibus comment on the laws that I mentioned. And Yusek Omali, you might want to comment on this.
Thank you, Mr. Chair. May we ask our USEC dads, please, to...
Yes, USEC dads, you're recognized.
Good morning po. Good noon, Senator Win. Good noon po to everyone. The Department of Education po fully supports the proposed bills that will make sure that the concepts being proposed will be part of the curriculum. Be it also known that the concepts are already integrated in our existing curriculum. So making this more permanent through the laws would really allow us to make sure that the concepts will be in our curriculum formally. Thank you.
Let me just I just want to point out the proposal of Senator Angara. Ang kanyang proposal, inclusion of pandemics, epidemics, and other public health crises as part of the curriculum. And then the other one, his proposal is requiring the teaching of disaster awareness, disaster mitigation as part of the curriculum. So both will touch on the curriculum, no? And the other proposals are more or less similar, no? So what's your comment on that, no? Because I know that we're decongesting the curriculum, no? I think we all agree that the curriculum has become congested over the years, and in fact, the reduction of your competencies is a signal that DepEd is in fact decongesting. So what's your comment on these two proposals?
There's always a way to integrate the concepts, Honorable Senator Win. So we will continue to integrate those concepts, even as we are doing the integration of concepts related to disaster preparedness.
Right now, I understand na meron kayong some form of disaster preparedness in senior high school.
Yes po.
Is this proposal of Senator Angara different or similar to your what you are doing right now?
It actually reinforces or supports the things we're doing now.
Okay. And then going on to disaster preparedness, now I would like to ask the head of the disaster preparedness task force to present to us the efforts of DepEd when it comes to disaster preparedness and learning continuity. No, I know for a fact that the disaster preparedness, most of the literature I read coming from DepEd focuses on the physical aspect of disaster preparedness. No, the learning continuity is not as pronounced. So maybe request from the head of your disaster preparedness to present the efforts of DepEd insofar as disaster preparedness is concerned.
Thank you, Senator Win. I think it's Director Ronnie.
Yes.
Sige po. Thank you po.
We recognize Director Ronnie.
Hello, good morning po.
Yes, Director, go ahead.
Yes po, good morning, Honorable Senator. Yun pong sa disaster preparedness, una po, in fact, meron pong integration na sa curriculum. We have mapped out, in fact, what subject areas is DRR, climate change, and even peace education integrated in the curriculum. We have the mapping of that po. Very recently in February, we were trying to actually, kumbaga, adjust, make it more prominent, concise. So a working group between the DRRMS and the Bureau of Curriculum Development. We did a workshop at Simeo Inotec po. We can give you what we have done in that regard. And the thing that to do is actually to further enhance this via looking at the MELCs, kasi hindi pa po yung MELCs ang tinignan noon, kundi yung K-12 talaga. So there is currently in those subject areas, yung climate change, DRR, and peace education and integration in the current curriculum. Let me make that clear po in various areas and in various grade levels. The second thing po is, you're right, Senator, yung disaster preparedness is very much part of various subjects. Kasama din po yung sa Araling Panlipunan, buong isang content po on climate change. Yun pong mga what to do before, during, and after a hazard. Kasama po yun. Makikita nyo sa MAPE. Pati first aid po. Kasama po yun. Very comprehensive po yun doon sa mga subjects na yun. And there is, you pointed it right, in the junior senior high school, a course actually on disaster readiness na course po. So meron po ang DepEd, medyo matagal na rin po, ilang taon na. We can present that, provide you po the necessary documents to point out where integration is actually or has been happening. So, and then may mga co-curricular activities po tayo. Halimbawa, ang risk assessment. Every June po, pagpasukan, reiterate natin ang ating, through a memo, yung ating department order pertaining to the student-led watching and hazard mapping. Kasi yun po ay nagiging bahagi ng planning ng school through the school DRRM coordinator, either headed by the school principal or school head or a designated teacher, doon po sa mga planning ng activities na ginagawa ng mga bata. Marami po sa ating mga schools ay may tinatawag na DRR camp or camping every year na ginagawa. May mga schools din na may tinatawag na Batang Emergency Response Team. Iba-iba po ang forma. And meron po tayo every year. And we can also provide the data ng schools natin every year ang sumasali sa nationwide simultaneous earthquake drill na isinasagawa ng NDRIMC, hindi lang para sa mga ahensya, pero tayo sa DepEd ay sinasama natin ang buong mga paaralan natin nationwide. And meron din pong mga contingency planning sa school level kasi may pondo po kaming binababa yung DRRMS sa ating mga divisions to conduct contingency planning. In addition, we have funds actually that train for school DRRM coordinators. Ina-extend pa lang po namin itong mga nakaraang 2 taon na hindi na lang yung school DRRM coordinator. Siyempre facing po dahil din sa concerns ng funds. Meron po kaming modules, 23 modules, kung tama pa yung alala ko, na ginawa namin since 2016 at yun ang ginagamit na modules na pang-train dito sa mga ating mga empleyado. Ito po ay ginawa with the members of the education cluster, UNICEF, Save the Children, at iba pa po kasama ang Red Cross. In fact, sa module na to, yung pong first aid ay module ng PRC, ng Philippine Red Cross. Hindi po namin binago yon, pero pina-adapt nila yon as is. At sila din po ang mga resource persons natin. So lahat po ng kurso ay iba-ibang partners po. May pool of partners din po kami, both for preparedness, response, at doon sa ginagawa nating psychosocial services, may pool of resource persons po tayo na mobilize natin every year. And on a quarterly basis, we actually have a systematic regular planning with all the partners po para sa programa ng DRRM, climate change, at saka peace education. So yun po. So I think ang tingin ko po, but we will provide, as you said so, Senator, comments, omnibus comments on the various bills that have been drafted by the Senate. But gusto ko lang din pong i-emphasize that many have actually been working po because since 2010, noong inilabas ng government yung NDRIM Act of 2010, halos lahat ng ahensya na membro ng NDRIMC ay meron pong DRRM na mga opisina. Yun po ang pinagmulan ng aming opisina sa batas na yon. Yun po ang kanyang legal basis. At mula noon ay na-integrate po sa planning and budgeting. Kaya may budget kami, though limited, as I have earlier told you way back, kung matulungan din kami doon. Though limited, ay umaandar po. One of the greatest challenge that we recognize in the department in terms of learning continuity ay yun pong curriculum. Because we have never had this kind of a situation po na pandemic. Kaya challenging po sa level ng curriculum. Kasi kung ito ay naging bagyo lang, naging lindol, lahat po ng mga temporary learning spaces, emergency feeding, yung aming pong learners kits, teachers kits at lahat ay regular pong umaandar. May challenges lang sa procurement but they are moving, Senator. Ang greatest challenge po dahil kakaiba at nasa bahay ang mga tao at lahat ay ito pong curriculum, delivering it in a very different context. Kaya yun po ang tingin ko na kailangan pagtuunan ng mga bills because all the rest are actually po working naman. Within the parameters, within the protocols of the NTRIMC and all the laws and the policies at mga operational guidelines and planning that are actually regularly happening among member agencies of the NTRIMC. So yun po ang aking take doon, Senator Win.
Thank you, Director Ronnie. Thank you for that. And would like to request from DepEd a position paper on all of the bills that I mentioned earlier. And I would like to also request from the body the same, position paper on all of those bills. We recognize Senator Pia.
Thank you again.
Mentioned earlier. And I would like to also request from the body the same, position paper on all of those bills. We recognize Senator Pia.
Thank you again, Mr. Chair. Sorry, who was the one speaking? I didn't catch your name. Preventive healthcare, a lot of that will end up in terms, a lot of that can only be implemented by way of educating and making people aware of what is preventive healthcare. No? And so if you dissect that, my question would be simple things like, where is it in the curriculum that you now talk about preventive healthcare and tell the children how important 8 hours of sleep is, the quality of food, tie that into the food supply, that they plant their own food in their that you now talk about preventive healthcare and tell the children how important 8 hours of sleep is, the quality of food, tie that into the food supply, that they plant their own food in their